My name is Philip Blurton and I'm the Principal Social Worker for Adult Social Care at East Sussex County Council. This is an introductory video about our newly launched Equality and Inclusion Strategy. Deciding to have an equality and inclusion strategy is a step in itself. It demonstrates that as an organisation, we want all sections of our community to have fair and equal access to our services. And for our staff, it demonstrates that we value their diversity and want a workplace where they are all included and can be themselves. Come and meet our teams, our clients and carers, and our leaders, talking about what this means to them and how our equality and inclusion strategy was created.
Equality is about creating a fairer society where everyone can participate and has the opportunity to fulfil their potential. It's about identifying patterns of experience based on group identity and the challenging processes that limit individuals' potential health and life chances. An equalities approach understands that our social identity in terms of sex, gender identity, race, disability, age, social class, sexuality, religion, and other identities will impact on our life experiences. Despite the challenges we face collectively and as individuals, we believe our equality and inclusion strategy will have real benefits for East Sussex residents. It's a work of shared values and vision created through listening to citizens, service users, communities, partners, stakeholders and staff.
We set about working on our equality strategy in July 2019. After a period of 6 months of engagement with 500 staff, partners, residents, clients and other stakeholders, we came up with 5 priorities that will help tackle some of the most prominent issues that our department is faced with. Through this strategy, we want to make equality more visible so that whether working for us or with us, or as a person using our services, people are always treated fairly and with respect and dignity. We have 5 key priority areas which will ensure we get to know our communities better. We collect more robust data from our clients, engage and include our residents in decision making, invest in staff training, and create a safe, fair and inclusive environment for our staff.
I'm really pleased that our new equality strategy will help us gather better information about the people we work with and will help us identify any gaps where we might need to improve. Understanding health inequalities better is the first step in addressing gaps in provision, and I am hopeful that this strategy will help us to do that. Like everything else, organisations have to continually strive to get better at provision of services, and I am pleased that I work in a team where non-discrimination and fairness are our key values.
As an employee, it's important to me that equality and inclusion is at the heart of the organisation and informs all policy, ensuring that all employees feel safe, welcome and valued. Training is important to raise awareness of unconscious biases and create an inclusive environment. It allows for diversity and difference to be respected and celebrated, as well as recognising disadvantage. As a practitioner, such values inform my practice with people to empower clients to be the expert of their own life and experiences, and allows for clients to be supported to have their own voice and choices. It's also about providing active support consistent with their beliefs, culture and preferences. I feel that putting the values of equality and inclusion into practice is a dynamic process which requires ongoing training, self-development and practice reflection.
So as Equality and Diversity Champion in my team, I try to see myself as unique, not different. It's important for each of us to recognise that we all have personal unconscious biases about different groups of people. This can be a difficult area for us to think about, but once we've acknowledged them, hopefully we can dispel these biases when they arise by consciously changing our behaviour to send a clear message about not reinforcing adverse stereotypes. So hopefully by our behaviour, it'll enable people to access the same opportunities and the same fair treatment. It's really pleasing to see that our new equality and inclusion strategy will focus on staff too.
We have to address the power structures that lead to people being treated unfairly and being underrepresented in all areas of the council, especially in the areas of senior leadership. Representation also brings knowledge, skills and experiences that, when listened to, can lead to changes in attitudes and approaches. Having an equality and inclusion strategy is long overdue. The fact that we are still talking about equality and inclusion in 2021 is embarrassing and worrying. However, I am happy that it is now formally on the agenda within an equality and inclusion strategy. It must now lead to real change. I don't want it to be tokenistic or a tick box exercise.
I want to be treated with dignity and respect. It's a basic human right. When a social worker comes around to my home, I don't want to feel like I'm being judged. I've already proved that I'm disabled. My doctors have supported me, so why do I feel like I'm being judged to see if I'm really disabled? It can feel like I'm under a microscope. I want to be treated fairly. I am a disabled lady, a little older, with the strong belief who's maybe just a little bit crazy. I hate discrimination. I have dealt a lot with it in my last 20 years, and some of it has been really horrid. I hope as service users I can help East Sussex with their equality and inclusion strategy. I think it's important that we as service users help social services. It is the only way things will change. If we as service users can explain what it's like to be us, then it will enable services to understand us.
Okay. We all know that living with prejudice is traumatic. If understanding service users allows for the impact of lived experience and positive equality and inclusion practices can accommodate them, then it gets to the heart of things more quickly. Sometimes healing is just in being seen and validated. It's a more effective use of resources. When people are working together rather than against each other, everything works better. When I'm in a caring role for my brother, I see how important it is for him to have his life experience acknowledged and the experiences that he wished he'd had. He's very cognitively impaired now, but he needs to be spoken to with the respect that is given to an adult man. He wishes that he'd had children and often wishes that he could be the man that he wants, who's there for his family and a provider. My brother's trauma is also my trauma. His life events have been my life events. Before any diagnoses or interventions, I was there trying my best to deal with the situation. As his carer, it's important to me the impact of my experiences as a sibling of someone with his level of challenges is accounted for and treated with care. An equalities and inclusion strategy would therefore impact positively on my mental health by association. I feel very positive about this strategy. It's a concrete signal that a humanitarian approach to service users is seen as important. It indicates that service users will be seen as holistic entities with a history, a voice, and a definition of themselves that will be validated and valued. The strategy asks service providers to see their users as whole people with valid challenges and strengths. It asks a lot from service providers because it will mean that they have to really pay close attention to the nuanced experiences of people who may not have had any shared social experience with them. Trying to understand where other people are coming from is very challenging, but ultimately central to what it is to be human.
Since becoming registered vision impaired in 2005, I have found that sight impaired and blindness people are not fully catered for when it comes to discussing, actioning for disabled people in so many aspects of life. I also find that when I attend meetings or going to functions, if I get to the meeting first, I'm sitting down, in brackets, looking normal and acting normal. But as soon as I get up and use my white cane symbol stick, I find people talk to me and react to me differently, not treating me as the whole person, a unique individual person. I also do not like it when people assume all I want to do is discuss my disability, which has caused me a lot of heartache and distress in my life. What people do not realise is when someone is affected by a disability, just treat us as you like to be treated, with respect, dignity and intelligence. Diversity just means inclusion, treating people as the person, not identifying them by their wheelchair, simple cane stick or disability. Means treat us as you like to be treated, with respect and dignity.
COVID-19 has bared the reality of disparity in our society. We need to make sure we keep working to ensure that people are not discriminated because of their backgrounds, where they were born, and what their race, religion, or ethnicity is. I'm looking forward to the setting up of Race Equality Reference Group that can bring together the voices of people from different cultural backgrounds of East Sussex together. There's an awful lot we still have to achieve in East Sussex, and this equality and inclusion strategy is a good start.
We need to keep engagement with residents at the heart of our work. With this new strategy, we've committed to include equality considerations in all our decision making. Equality and engagement will be in every project initiation document, in every report that goes to senior management, and in the planning and commissioning of all the work we do. We are making inroads into improving our communication and engagement with our clients and residents. By putting fairness and equity at the centre of everything we do, we want to show we mean business when we say we want to bring sustainable and equitable changes for everyone. I'm very proud of the work our teams do, and with the new equality strategy, I'm sure that we will get better at our equality data monitoring, performance and analysis.
In order to be effective commissioners, we need to understand our local population, identify those least likely to be heard, be proactive in reaching them through our engagement activities, and consider the needs of those who experience the worst health outcomes. With this strategy, we are placing client and carer inclusion and citizen engagement at the heart of all of our work. With more insight into what our clients, their carers and our residents need, we can directly influence our practice, policy and planning. By ensuring that the voices of local people are reflected appropriately, we can commission services and support which better reflect the needs of the residents of East Sussex.
Our practitioners on the front line are engaging with clients and carers from diverse backgrounds every day. I know we want to get this engagement the best it can be to make the greatest positive difference to the lives of everyone we are working with. Understanding where this can go wrong and what can make it right is directly and crucially relevant to our role. This strategy will help us better understand the needs of all the people we serve, enabling us to maximise the difference we can make through each interaction with a client or a carer. The strategy also demonstrates that we value and support the diversity of our workforce, whether we are out in the community or with our colleagues at work. Getting it right for our clients, carers and our practitioners is fundamental to meeting our legal duties and making East Sussex a more inclusive, better place to live and work.
I have been truly inspired by the way in which so many people came forward to be part of this film, and importantly, are coming together to help implement the strategy. The strategy gives us specific areas of work on which to focus, sets tasks and requirements to move us forward, and is an explicit statement of where we stand on equality and inclusion. At a time when there are so many irrational and intolerant voices clamouring for attention, it is more important than ever to nail our colours to the mast and show others where we stand. Equality and inclusion must be at the heart of everything we do and everything that we are. As Principal Social Worker, I am proud to stand by our strategy and see it shared as part of Social Work Week 2021. Thank you for watching.